Are you ready to take control of your own health? Do you want to create a plan that will improve your health and vitality without the use of synthetic drugs or needless surgery? Hi, this is Dr. Tom Roselle. I would like to invite you to join me and the Roselle Center for Healing for an information, fun-filled day that will change the state of your health and quality of life. Ageless Health 2011 will provide you with the resources to begin your journey towards being stronger, having greater physical performance, and living longer without impairment, pain, or disease. Ageless Health is about realizing that your health is a do-it-yourself program. You can have it all. Ageless Health 2011 is your first step towards creating and enhancing your natural health plan. Register today to reserve your seat.
Ageless Health 2011 is September 17th at the Fairview Park Marriott. Learn more at rosellecare.com. Register before June 20th and receive 15% off seating. Call 703-698-7117. 703-698-7117.
Dr. Tom Roselle live right now, 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I am live in studio waiting for your phone calls. We have a very active and interesting program for you today, but you can get a hold of me. 888-630-9625. That's 888-630-WMAL. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem and you've tried and you applied. Well, maybe we can put you in a different direction, something that might actually work for change. Wouldn't that be a kind of different track on things? Give us a call, 1-888-630-WMAL. We're going to talk about summertime injuries and summertime athletics. You know, those things like golf and tennis and walking. You know, things that you'd like to do that maybe you can't do, things that you do and then all of a sudden you get hurt and can't do it for the rest of the summer. There's ways of preventing that. There's ways of making sure that you can and putting up with these problems like your back hurts and your wrist hurts and you can't make that swing, or you got a slice, or you got something that just won't go away. Well, those are all biomechanical problems that can cause you all kinds of things, but nevertheless, they may end up stemming from something that you're not even aware of, and we're going to talk about those some things, actually. I have a very special guest, somebody that many of you have heard repeatedly, and not only on Dr. Tom Roselle Live, but in our lectures in our office, in our Ageless Health Seminar. Someone who I think the world of and is an expert in this area, Dr. Harlan Browning. Good afternoon, sir.
Good morning, Tom. It's always good to be here. Mm-hmm. And there's lots of information that we're going to talk about specific to summertime injuries. And you know what? I want to throw in there also outdoor activities like gardening, like I was doing all day yesterday. And my back's a little bit sore, so I might have to have you work on me tomorrow.
Well, we'll get that done tomorrow. But you know what? God bless you, because I hate that stuff. You know, there's an old story that was kind of interesting. I was out, I never mowed the lawn, and I never do the garden. We have a big place, and when the kids were home, I had them do it, and that was they did that, and they got a paycheck at the end of the week called their allowance, and if they didn't do it, they didn't get their allowance. So, you know, if they weren't going to do it, I would figure out a different way to get it done. But this day I was irritated with the world, nobody was home, and I decided to go mow the lawn. So I got the lawnmower out. And I'm out there, and I'm sweating, and I'm talking to myself, and I'm irritated. And all of a sudden, flying out the door from across the street is my neighbor. And she's got a camera, and she's taking pictures. I said, "What are you doing?" She said, nobody will ever believe this. And it's gone down in history, and that was years ago.
Well, it's been photographed, and now it's documented.
But I will fix you tomorrow.
Okay, please,
okay,
yes.
I will fix you tomorrow. Let's talk about the subject a little bit, because a lot of people are hurting. I know this Wednesday evening in office, you are going to be our lecturer for our in-house continuing education program on specifically this subject, on summertime injuries, from mowing the lawn to golfing to tennis to walking. And if you'd like to attend Dr. Browning's presentation, give our office a call. It's 703-698-7117. That's 703-698-7117. Let's start with something that is kind of obvious. What predisposes people to all of a sudden, you know, they've been doing great, and all of a sudden they get outside and they ain't great anymore?
Well, I look at two things. Improper form. In other words, they're not doing what they should be doing when they're performing their sport, and poor equipment. As you know, my background originally before I went into chiropractic was strength and conditioning, and I worked as a strength and conditioning coach at the high school and the college level. And I think I spent just as much time working with the athletes developing their physique as I did educating them on how to do things correctly, how to lift a weight correctly, why shoes need to be replaced. Running shoes should be replaced every 6 months. So I look at form and I look at function, and certainly look at the equipment they use, because if all those things are not right for them, then we're going to have problems.
You know, the biggest thing that we see is people not having good functional considerations, and that doing what we do and specializing in applied kinesiology, which is the relationship neurologically between muscle systems and other things, particularly internal organ systems and acupuncture circuits and so forth. You particularly, I'll watch you all day long, and you have people walking out in the hallway, up and down the hallway. You're looking at body function, and you're looking at the way the mechanics of the body, and people will sometimes say, well, I don't feel bad, but you see the predisposition. You see things that are ready to let go, and people don't understand that they're an accident waiting to happen, that they have problems that are underlying this. And what do you normally look for? How can somebody tell that, you know, they're going to get outside and they're going to try to walk for the summer, they're going to want to take some weight off, or they want to start playing some tennis, or they're going to start doing some cycling, or they're going to play some golf, and they're going to go take golf lessons, and all of a sudden they say, I can't do this because they fell apart?
Well, I think the first three things that anyone can do is, number one, stand in front of the mirror, take your shirt off, and look at your posture. Is one shoulder higher than the other? Is the head tilted? Is one knee bowing in or bowing out? Get someone to watch you walk. You'd be surprised when you walk and have somebody analyze you, you'll see that things aren't necessarily symmetrical from one side to the other. And then range of motion, that's a biggie. How easy is it for you to touch your toes? Can you reach around your back? Can you bring your arm across your body? Those things are very important. And if you're doing a sport and you don't have that capacity, then the likelihood that you injure yourself is going to be much higher.
You know, we involve ourselves in these injuries, these sport activities in the summertime, and it's because, you know, we get hurt. We haven't been prepared. We don't do anything in the wintertime. We're the weekend warrior syndrome, if you will. And we get out and we start breaking down. And we do things that we should be able to do that we did last year, we did the year before. We went on a hiking trip, and we buy into the medical paradigm that, well, you know, if we get rid of the pain by taking a couple of aspirin or Tylenol or whatever, and we don't perceive the pain at the moment, that there's no problem. There's no predisposition. The problem is that it's there. Let's dissect one of these things. Let's dissect a golfer, or somebody that's going to go out and start golfing. And what we see with golfers many times is neck, shoulder, arm, hand problems, and low back problems. So is it safe for somebody to go out and start golfing if they have, and I'm going to let you fill in the gap, what does the body posture look like that they should be staying away from?
Well, I think the key thing when you look at golf and tennis also is the mobility in the low back and the pelvis. Does a person have good motion in the hips? If they don't, then they're going to compensate by moving their upper body and their shoulders more, or they're going to have to use their feet, ankles, and knees more, and this often leads to what we call overuse injuries, the tendinitises and the bursitis. Certainly we see it a lot in the elbow, so there's golfer's elbow, and we can see it in the shoulder as a rotator cuff problem, and we can see it in the knee as a patellar tendinitis. So I look real closely at motion and core stability in the pelvis and the hips.
We're talking about sports injuries and summertime sports injuries, not things that you have to be an Olympian to do, but things that all of us do, from walking to tennis to golfing to cycling to doing little things that in many situations we're not ready to do. Subsequently, we get hurt. And in so many primary conditions we're predisposed means that we're not ready to do those things. Give us a call at 888-630-9625. That's 888-630-WMAL. My guest in studio, Dr. Harlan Browning, expert in sports injuries. We were just saying that Dr. Browning was involved in this before he became a chiropractor and specialized in the areas that he does specialize in. Big background in preparing the athlete, this is an opportunity. Give us a phone call. This Wednesday evening, Dr. Browning will be your host at our office at the Roselle Center for Healing on Wednesday, the 15th of June. If you'd like to attend Dr. Browning's presentation, and they're always excellent, as many of you know who've attended before, give our office a call at 703-698-7117. Remember, these lectures are always a courtesy to you. It's our way of informing you, and it's our way of making sure that you lead a structurally and biochemically sound life, but you have to call. You have to call because we only have so much space. So 703-698-7117. A golfer comes in and he's got low back pain. And, he says that he's had to give it up for a while and that, as long as he doesn't play golf, that his back is tight. But it doesn't hurt. He doesn't get the radiation. That rotational motion, that one-sided motion, if you will, because it's not equal in its distribution, causes a torquing in the low back. Guys like Tiger Woods and so forth travel with chiropractors, and they get treated on an ongoing basis. It's incredible that we think that we can do nothing all winter long and then go out and play golf. When you see a patient that has an injury like this, the underlying problem is something that can be prevented. What do you tell these people? They're hurting. You tell them that you can fix them. You tell them that they should have done this. Do you tell them? And what's the pathway?
Well, outside of a small handful of different disorders, I think most people who have pain when they're performing a sport can continue to play that sport if they find out what's causing that pain to begin with. Meaning, if we have low back pain in that scenario you just gave me, is that coming from a degenerative disorder? In other words, the disc or the vertebrae are degenerating? Is it coming because the musculature is becoming fibrotic? In other words, there's scar tissue in there? Or is it coming because the nerves that pass out of the spine are getting compressed or irritated along their course? Or certainly in many situations it can be all the three. So you want to figure out where it's coming from, and just because we have pain in that area doesn't necessarily mean that the problem is primarily from that area, and that's what I think gets us in trouble in sports med all the time.
Dr. Harlan Browning, senior colleague in my practice, one of the brightest that we have. He's talking about sports injuries and will be your host, your presenter, this Wednesday evening at the Roselle Center for Healing. We'd love to have you as a guest. Meantime, let's go to the phones. Laura, you're waiting patiently. How can we help you?
Hi, Dr. Roselle. Thank you for taking my call. I had a relative who went to do a kidney screening, and they took the sample of the urine and tested it, and they told her that she had a creatine ratio of 30 to 100, and they said this was abnormal. So what causes this? It's a protein thing, I think. What causes this to happen? Is it food that she's eating, or what is it exactly?
It can be many things, Laura. It's one of those situations that's not straight up and simple. First, you look at dietary, you look at chemical in this situation. You have to look at the things that are being put in the body. Is there enough water that's getting in? So many of us are simply dehydrated, and we're not getting enough water to flush our system out. So all the proteins and all the toxins begin to back up. They've got to go in the system. If our body is too acidic, when the body's acidic, we start pulling calcium out. And that compounds it because it has to filter through the kidneys as well, and it gets stuck in the tubules of the kidney. And you look at those pathways. You look at medications. You look at, as I said earlier, the sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten. All those things can cause kidney impairment. But then you look at neurology. The nerves that go to the kidneys come from the middle portion of the back. And if those nerves are irritated, then the kidney is not going to filter. You look at the acupuncture system. The acupuncture energy pathway that goes to the kidney is called the kidney meridian. They're named for the organ systems that they go through. And if that's not working the way it's supposed to, then the kidney can't flush. So there's a multiple approach that you have to evaluate when you evaluate this type of condition. It's not that simple. But I would start with dietary, making sure that those things we just talked about are not in the diet. I would look at the amount of water that the person's drinking or not drinking. I would look at the things that they are drinking, get those things out. But I'd have to look at much more. Laura, I thank you for your phone call. I appreciate it. We're going to have to take a break in a couple of seconds. My guest in studio today, Dr. Harlan Browning. We're talking about sports injury and the prevention and those things that shouldn't be able to stop you from doing the things that you love to do, golf and tennis and walking and cycling and so forth and so on, even gardening, and that's sports injury as well. Give us a call at 703-698-7117. Register for Dr. Browning's presentation this Wednesday evening. We'll be right back.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're in studio, 888-630-9625. That's 888-630-WMAL. Love to talk to you. Our subject today is summertime sport injuries. You know, those things that you do, playing golf, tennis, walking, riding, swimming, you know, all the things you like to, even in the garden. My host, coming up this Wednesday evening, is Dr. Harlan Browning. He will be your presenter and talking about these types of issues on a one-to-one basis. This is Wednesday, the 15th of June. If you'd like to attend Dr. Browning's presentation, give our office a call at 703-698-7117. That's 703-698-7117. Let's go back to the phones, Dr. Browning. We've got several people waiting, and I don't want to ignore them. Robert, how can we help you?
Yes, good afternoon. You're covering a great topic today. I'm 51 years old. I got rounded shoulders, poor posture. It's genetics, and I got a forward head, not extreme, but it is forward. Have experienced several injuries due to repetitive motion with a computer. What can I do to try to help prevent future problems? You know, doing gardening or just swinging a golf club or something along that line.
Hi, Robert. It's Dr. Browning. What you have is what we refer to as upper crossed syndrome. It's a term that was coined by the late, great Czech physician Vladimir Janda, which basically means that certain muscle groups are becoming too tight, specifically your pec muscles and your trapezius muscles, so that's one half of the cross, and certain muscles are becoming weak, your deep flexors of your neck and your lower trapezius, so that's the other part of the cross. So as you try to fight gravity, and that's what we all have to do, these muscles continue to weaken and also get too tight, so it pulls you forward. As that happens, then your spine's going to adapt to that by remodeling itself. Ligaments are going to shorten, bones are actually going to start to deform, and it's going to become more rigid. So the structure of your spine is going to become very stiff, which is going to make it uncomfortable for you to sit up, and certainly uncomfortable for you to go in ranges of motion that require you to be very upright. So when I look at a problem like this, I always consider, what's the foundation like? What is the spine doing? If you don't have good mobility in your spine, you can exercise till you're blue in the face, and it won't make an appreciable difference as far as your posture is concerned, because it's almost impossible for you to get upright when the spine has locked itself into place. So we got to get mobility into the spine, then recondition those muscles that have become weak and strengthen those muscles, stretch those muscles that have become too taut.
Robert, what you also have to look at is from the foot up. The pedal base is really important, and if your arches are dropped, and there's 6 major arches or basic arches in the foot, if they're not working in synchrony, then everything else is going to be exacerbated. Your condition will get progressively worse. As we said earlier, every muscle in the body has connections to other components, and that's through the neurological trains of the system. So as you're evaluated, but stretching, as Dr. Browning said, and opening up those muscles in the front and strengthening the ones posteriorly, that's the preventive piece. But if there's any structural aberration and damage, that has to be addressed first. I hope that
syndrome was upper cross syndrome?
That's
upper
correct.
Cross, that's right.
All right, thank you very much.
You're more than welcome. Thanks for calling. Appreciate your phone call. We see that kind of thing often.
Yes, we do. And my background, as you know, is rehabilitation and strength and conditioning, so I have a great appreciation for exercise and all those types of things. But I have to say that if you don't have the capacity, the framework doesn't have the capacity to allow those muscles to go through a full range, then we're kind of cheating ourselves of the big picture as far as getting better.
This Wednesday evening, the 15th of June, Dr. Harlan Browning, my guest today, your host this Wednesday evening at 7:30 at the Roselle Center for Healing, is going to present a whole evening on summertime injuries, and whether they're sports injuries or whether they're gardening injuries or they're things that all of a sudden summer came about and you're hurting. Well, this is your opportunity to find out what you can do about them. Give our office a call, 703-698-7117, 703-698-7117. Tell my staff that you'd like to register for Dr. Browning's presentation this Wednesday evening. It's free to you, but we need the reservation. Coming up in September, very, very quickly, September the 17th, to be exact, is Ageless Health 2011. It's an event that's going to transform your life if you're serious about taking charge of your health. This is something that you can apply immediately. We spend the whole day educating you and at a very, very high emotional level, putting you on track. You have until the 20th of June to call and register or go on our website at rosellecare.com. That's ROSELLECARE.com, and take advantage of a 15% discount in the price. But that's only until June 20th. After that, not going to happen. So take advantage of it right now. My guest today, Dr. Harlan Browning. We're talking about sports injuries.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. We're here at 888-630-9625. That's 888-630-WMAL. My guest in studio, Dr. Harlan Browning. We're talking about summertime sports injuries, things that you do in the garden, with the tennis racket, with the golf club, walking, cycling, you name it, and you can't do it anymore. Well, we're discussing that, and Dr. Browning will discuss it more in depth this Wednesday evening at our office at the Roselle Center for Healing. If you'd like to attend, 703-698-7117. That's 703-698-7117. The phone lines keep filling up here, my friend, so let's do that because everybody's on subject for the most part. So let's talk about it. Kathy, thank you for calling. How can we help you? Kathy?
Hello.
Hi.
Hi, thank you for taking my call.
Thank you for calling.
I had a question. Wondered if you could address the psoas muscle, if I'm saying that correctly, P-S-O-A-S.
Yes, psoas, the filet mignon, yes.
Okay. I've heard that it can become contracted and even permanently contracted and become a source of chronic pain, and wondered how can it be determined if that is the source of a chronic pain in that part of the body.
Sure, but glad to talk about it. Actually, Kathy, 80% of the time the muscle's not contracted. It's the opposite one that's weak, and it's causing that one side to look like it's contracted, but we'll talk about that for you.
Kathy, was there an injury that preceded this problem?
No, perhaps just a slight strain, but not an injury.
So it's gotten progressively worse over time?
It has, but there's been other things in this particular case going on in that part of the body as well.
Now, who told you it was your psoas muscle, or you're presuming it is?
Someone had said that it felt tight, and we're trying to rule out.
Trainer or doctor?
Doctor.
Well, if, let's say, the psoas muscle is tight, and that certainly does happen, one of the first things that I think about is something called strain counterstrain. That is a technique that physically works to relax a muscle. In other words, muscles get too tight and they don't ever shut off. Well, there's ways that you can trick the muscle to turn itself off. But looking at the big picture, we also have to ask ourselves, is there any kind of adhesions or fibrosis that have changed in the muscle itself? That becomes very important when you're looking at the access or the ability for you to get in there and relax the muscle. So that might want to be looked at also.
The other things that you look at, Kathy, when it comes to the psoas muscle is the functional capacity of the spine, particularly where the rib cage ends and the low back starts. Those are the nerves that go to that muscle. Additionally, there's some other areas as well. You also look at the feet. There are bones in the feet that when they're not striding properly, when your gait is not properly, is going to cause the psoas muscle to weaken. So you look at all of those capacities, but again, the likelihood that it's a tight muscle is, it can happen, as Dr. Browning said, but it's probably more of a weak muscle. But in true muscle function testing, if it's tested properly, you'll be able to tell whether which is which, and you can ascertain it from that.
And is that muscle testing that you're referring to, is that the applied kinesiology or some other form of testing?
Yeah, that's part of the applied kinesiology. So what we're trying to do is isolate the psoas muscle itself. The psoas is a part of a larger complex that we call the iliopsoas. There's another muscle that's right next to it. It's kind of like a little brother called the iliacus, and it does a similar type movement. You also have to consider that you have 3 or 4 layers of abdominal muscles that sit on top of that too, plus some of the muscles of the adductor group, the inside part of your legs that are right in that area also. So any one of those can be causing the type of pattern that you have. So the best way to determine is to individually test all those muscles to see whose strength is adequate and whose length is adequate.
And that's something that you do in your office?
Certainly.
Yes, absolutely. Applied kinesiological muscle testing is simply muscle testing that is done to find out muscles that are weak versus muscles that are strong and the individual patterns of the muscle. You have to isolate them. You have to separate the iliacus from the psoas. You have to separate them from other areas. The angle of test has to be accurate. The psoas is a very difficult muscle to palpate, and because of all the layers that Dr. Browning just described, and it has to be done exactly to find out. But it can be done, and it can be fixed, and it's not something that you have to deal with.
Wonderful. Thank you for taking the call.
Thank you, Kathy. I appreciate your phone call. This Wednesday evening, Dr. Harlan Browning, my guest in studio, will be your host presenting an evening on sports injuries, prevention, how to handle them, what to do when they're bad, everything from cycling to golfing to tennis to things that you do around the house and gardening. All of you are athletes this summer, whether you think you are or not, and we'd love to have you as our guest, 703-698-7117. Roselle Center for Healing is located in Fairfax, actually just off the National Capital Beltway on Route 50. Very easy to get to. The class starts at 7:30. Love to have you as our guest. Let's go back to the phones. Lawrence, how can we help you, sir?
Hi, I'm in the Army, and I run all the time. And minimum run for me is 2 miles. And I've got a recurring ankle injury. And I'd like to know some exercises to strengthen the ankles. Because once I pass 3-4 miles, the ankle becomes so sore that I can't run on it for about 3-4 days.
Lawrence, do you remember if you specifically injured it at one time or just something that just slowly...
Yeah, I think I've rolled it a couple of times in the past.
Okay, so the pain is on the outside part of your ankle?
Generally, but then the entire ankle inflames.
Okay.
And then when I do a foot rotation, you're hearing a crunch, crunch, crunch.
Okay.
You know what I mean?
Right. How old are you?
46.
Okay. Have they taken an X-ray of the ankle?
Yep, and I've had an MRI too. What I'm finding is that there's a little bit of arthritis in the ankle, but no major damage.
Okay, so the crunch, crunch, crunch you hear is probably a little bit of the degenerative change, the arthritis in the ankle, and also it's not abnormal necessarily to hear the crunch, 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 because sometimes when our tendons move across a bone, it'll do that too. So, is there pain when you move it around?
No, not unless it is right after a run or something like that.
Does it hurt you when you start? When you start running?
When I start? Yeah, there's about a little bit of a warm-up time. So it doesn't hurt, but it's stiff at first. So it's
stiff, a little irritating. You start running, it feels better, then it gets bad as you go along.
Yeah, once I pass about 3 miles, then it starts getting to the point of, it's painful. So I should pretty much, stop.
Okay, so Lawrence, usually when a pain starts after a certain period of time, that tells me that the structure can't support itself. In other words, that the muscles that surround the foot and the ankle that actually provide a sling and hold the arches up. There's really 3 major arches in the foot. There's a medial longitudinal arch, there's a lateral longitudinal arch, and then there's a trussing effect of a transverse arch that holds that up. There's 2 muscles that come in from both sides. That physically lift it and support it. So if those muscles can't do that job or they fatigue too soon, then the foot starts to collapse and the position of all the bones in there, and there's tons of bones in your ankle and your foot, starts to become compromised. Then all of a sudden you develop pain. Have you ever had any pain also in the hips or the low back?
Lower back at times.
Okay. So there might be a nerve that's getting irritated to the muscles of the ankle and the foot that's causing them to weaken over time. So to address this, you might want to have somebody look at the big picture, not only what's going on locally at the ankle, but also what's going on at the knee, the hip, and the low back. And Dr. Roselle, I know that you do this as much as I do. One of the first things that I assess is the way the person walks, and we use that gait scan machine that physically is a force plate that looks at how a person dissipates their weight when they walk.
If you have to look from the foot up, but you have to look at all the other mechanics, because everything is interconnected. Nothing is individualized in the body, and you have a synchrony that your body tries to maintain, and as soon as something goes awry, everything else begins to break down. Once you loosen up and you're stretching things out, you're good for a few minutes, but now what you're doing is you're pounding, you're walking, or you're running, and because there's a distortion there someplace, one of the bones in your foot can be out of position. The talus is one of the most common that will cause these types of problems. The two long bones of your lower leg, the tibia and the fibula, come down together at that level, and if they have any tendency to split, meaning just to pull apart a little bit, and we're not talking about huge, we're talking about less than a millimeter, there's a fascia that wraps around it, and that begins to stretch, and so nothing holds properly. So you have to be able to determine which is which to be able to fix it. But it's fixable. It's not something. The fact that you're able to run even a little bit says that that's totally reversible.
Right. Well, what I was curious about is, are there any like stretching exercises or actual exercises that could, strengthen the ankle?
Well, the stretching part is probably, you don't want to do that, because I bet you a lot of those muscles have already been stretched too far, and that's the lack of support. You'd want to work on balance, so just practice standing on one leg, because that's very dynamic. If you can get your hands on what's called a Bosu ball, which is kind of a half of a ball with a solid platform, you can stand on that, and it works your proprioception and builds dynamic strength. And then if you have a TheraBand, that's kind of like a giant rubber band, you can put that around your foot and move it in resistance in different planes, and that will help to strengthen those muscles. But again, if the support of the foot has been compromised, then that probably will get you just so far.
The other thing that you can do is an old cheap therapy is get yourself a golf ball. Put the golf ball on the floor. Put your foot on the golf ball and roll your foot back and forth, up and down, side to side. If you find really sore spots in your foot, work them even more. The first couple times you do it is going to leave your foot sore for a couple minutes, or a couple days rather, and over time it'll get progressively better. But again, I agree with Dr. Browning. It sounds like the mechanics of the foot, you've got some weak muscles in there, and that those muscles can be turned off anywhere up the line from the knee, the hip, to the low back. So you can try those things, and if you'd like more information, join us Wednesday night. We'll see what we can do and help you out that way.
All right.
David, thank you very much. Thank you for your phone call. Appreciate it. Lawrence, how can we help you? Or David, I'm sorry. David? David dropped out. He had a question on thyroid hormone. You have a statement.
You know what? Let me add something to that last call, and I think that was a good impromptu. We just got back from a great conference, an applied kinesiology conference, and one of the presenters, who's one of my favorite guys to hear talk because he's just that smart, David Leaf.
Dr. Leaf is amazing.
He did a presentation on something that we don't hear enough about in physical medicine. Physical medicine means people who work on aches and pains, something called peripheral nerve entrapments, which means that the nerve is getting compressed or pinched outside of the spine. Very often it's hard to find that compression, but it becomes a really important thing to look for with chronic overuse injuries like the last caller was describing.
Yeah, it's imperative. I mean, it's like your hands being numb and your hands tingling. It can be a carpal tunnel. It can be the bones of your lower arm being not in a mechanical alignment that they should. It could be coming from the neck. The same thing with this. That nerve can be trapped anywhere along its course and cause problems not at the site of entrapment but distally.
Right.
And when that happens, you've got to be able to isolate it. You've got to know the muscles that are weak. You've got to know what the gait mechanism is doing, and you fix that. In this situation, I agree with you. Overstretching may make them worse.
Right, and the peripheral nerve entrapments, I think applied kinesiology really shines, because by doing that specific muscle testing, we can test little tiny muscles and basically go all the way up and trace that nerve back to the spine. And by knowing which muscles are weak, we can figure out exactly, like a GPS, where the traffic jam is, where the issue is.
We're going to keep that in mind, and we want to remind you this Wednesday evening, Dr. Harlan Browning will be your host talking about these types of things. We'd like to have you join him at 703-698-7117. That's how you make your reservations.
Dr. Tom Roselle Live continues now on 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live. We've been in studio at 888-630-WMAL. As always, love to take your phone calls. If you can't get a hold of us today on the program, you'd like to talk to us off the air, give us a call at 703-698-7117, and one of my doctors will get back to you, or get a hold of us online at rosellecare.com. That's ROSELLECARE.com, and address your questions, and we will answer you. But this Wednesday evening, more important than anything else, we are going to be presenting this topic. Dr. Browning is going to present this topic on summertime injuries, whether they have to do with gardening or golfing or tennis or running or walking or any of the things that you like to do that maybe you can't do at this point. We'd love to have you as our guest. 703-698-7117. As always, this is a freebie to you, but it is something that does require registration. Let's go back to the phones, and David, are you there now?
Yes, I was cut off, Dr. Roselle.
That's okay, sir. How can we help you?
Question. I'm an athlete, older man, but I work out anaerobically and aerobically regularly. But I have a conundrum, two questions. I'm hypothyroid, and I don't know whether I'm better off on Armour or Synthroid, although I know Synthroid's a synthetic, and my temperature is never up to 98.6 by taking oral or underarm with a digital thermometer. Do you have any advice? I
have a lot of advice. Unfortunately, we don't have a lot of time, so I'm going to give you a couple quick things. Write me and ask me again, but I'm going to do this for right now. Always, if you have to be on medication because your thyroid can't work, then a natural form is always better than a synthetic. The Synthroid thyroxine T4 has to be converted into T3. The conversion of any T4 takes place in the liver. So you have to make sure that those areas are working well. Thyroid problems, we're seeing more and more of them today. Up to, some authors are saying 38 to 40% of people that are walking into our practices have the beginning stages of a Hashimoto's thyroiditis, an inflammatory immune reaction. And that comes from a lot of other different pathways. But how you determine thyroid function is by a whole series of tests, not just TSH and T4, which unfortunately most physicians, that's all that they'll order. You've got to look at what actually is being done. The thyroid produces T4 thyroxine in the presence of iodine and trace minerals and amino acid called tyrosine. And so you have to know whether those are adequate or not. The liver has to work properly to get that conversion going. And then some of it takes place in the kidney. But so there's a whole lot of activity there that's going on that we could spend the rest of the program on. Get a hold of me, David, on the web, and I will go back to you and give you some more information. I really appreciate your phone call. Thank you. We only got a couple minutes left, and we have another phone call that I think we're going to take, and then we're going to get back to what we're doing. Rick, how can we help you? We've got to do it real quickly, my friend. I'm sorry.
Yes, hi, doctor. I was diagnosed with a herniated disc in the 04-05, causing a pinched nerve in my right leg. I'm an avid golfer, and I'm just wondering, I'm concerned about getting it operated on to correct it versus just I'm able to get back to doing what I've been doing, and I'm an avid golfer trying to work on my golf game.
Rich, let me ask you a couple quick questions. Do you have pain in your legs?
I'm sorry?
Do you have any pain in your legs?
Yes.
Okay.
Mild, but not much, but it's mostly just numbness and some tingling.
Is it back pain and leg pain, or leg pain only?
Leg pain only with just discomfort in my back.
Okay, the fact that you can move and function and you're not in excruciating pain says that this thing can probably be taken care of.
Yeah, Rich, the one thing that you have to be very leery of, especially when they're doing surgeries, 7 years after the original injury, is anybody suggests that they do some sort of fusion. In other words, they take a piece of metal and basically lock those two vertebrae in place. The reason that becomes problematic is it's going to make the levels of vertebrae above it and below it more susceptible to degeneration.
Rich, thank you for your call. I have to break. I'm sorry, but get a hold of us online. We'll talk to you a little bit more about it. But based on what you're telling us, it can be dealt with. What you have to remember is over 50% of all surgeries are ineffective. They don't work. And there's other ways of doing it and really return it around. I appreciate your phone call. It's been a fast program, as always is. This Wednesday evening, Dr. Harlan Browning will be your host in our office at the Roselle Center for Healing on the topic that we've discussed today, summertime injuries of all sorts. Give us a call at 703-698-7117. As always, Thermography Centers of Fairfax has been part of the supporting mechanism in this program. We will see you next week, 12 o'clock noon. See you then. Bye-bye. Health is a do-it-yourself program. That's reality and the title of my new book. This is Dr. Tom Roselle. Health is a do-it-yourself program is a most understandable introduction to natural health care. My book will take you step by step through why the body breaks down and gets sick, but also how it repairs itself. You will finally understand the often confusing world of natural care. Order it today by going to Amazon.com or from our website, RoselleCare.com. That's RoselleCare.com. Hi, this is Dr. Tom Roselle. If you're looking for a wellness and healthcare environment to showcase your business, products, and services, consider being a wellness partner of Dr. Tom Roselle Live and the Roselle Center for Healing. From in-show advertising to on-site events and digital marketing, we have several offerings that can highlight your business with a well-received and established audience. For more information, visit WMAL.com, keyword Roselle, that's ROSELLE, and click on Become a Sponsor.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.